Good day, my name is Claudia Gray. I'm a pediatrician and allergist, and I come all the way from South Africa where I practice in Cape Town. Now, I would like to pledge my full support to the Primary Immunodeficiency Diseases Week, which is a worldwide endeavor to raise awareness on the diagnosis and timely and correct management of primary immunodeficiency diseases. This week will take place from the 22nd to the 29th of April of this year. Now, many children, many adults suffer from a primary immunodeficiency disease. It's a disease in which the immune system, which fights infection, is deficient or defective to a small or large extent. And of course, this leads to symptoms of increased infections and the many complications that can come from that. The presentation can be mild, such as recurrent sinusitis or ear infections, or more severe and frankly life-threatening in some cases. We do have good diagnostic tools these days to diagnose such immunodeficiencies and some clues which every clinician and every parent should be aware of as to who might well have a primary immunodeficiency. So in this condition, the sufferers normally have illnesses which are recurrent, so more often than expected for age. They can be unusual, so really odd infections which are not very common at all. They can be persistent. In other words, they take much longer to settle than is the average, and they can be resistant, so resistant to standard treatment, perhaps needing hospitalization and intravenous treatment. These conditions to a certain extent can be treated. Treatment can be expensive. Sometimes it involves immunoglobulins or plasma products. So we need to help to ensure that our sufferers are supported with medical aids, for example, coming to the party, and also with the availability of blood products, which of course could be interrupted in a pandemic such as the current COVID-19 one. So, on behalf of all allergists and immunologists in South Africa and on behalf of our patients, I'd really like to get all of your support in helping to raise awareness of primary immunodeficiencies and doing our best to fight for treatment for our very precious patients. Thank you.